everyone, my name is Jaylene Sims. Thank you for tuning back in to the Love Your Life series. Today we're going to discuss quick tips for diabetes care. First, we're going to start off with the ABCs of diabetes care. A stands for hemoglobin A1C. Your hemoglobin A1C tells us what your average glucose or blood sugar has been for the past 2 to 3 months. It also allows your doctor to know how well your blood sugar has been controlled over the past 2 to 3 months. If you're on diabetes medication, we want that number to be under 7%. That is recommended by the American Diabetes Association. But if you can get that number below that, even into the 6.5 or 6 range, that's even better. So how can you improve your hemoglobin A1C? You can improve it by making sure you take your medications on schedule as prescribed by your doctor. You can also make sure that you modify your diet, making sure it's a low-carb diet. You can do your exercise and do other things that will help you with your blood pressure, your sugar, and your cholesterol. B stands for blood pressure. A normal blood pressure is under 120/80. However, if you are on blood pressure medication, as long as your blood pressure is under 130/80, that's great. So what's the importance of your blood pressure? High blood pressure increases the amount of work that your heart has to do in order to pump blood throughout the body. Also, high blood pressure will increase the chances that you have for developing heart attacks and congestive heart failure. So we definitely want to make sure that you keep your blood pressure as low as you possibly can. So what are some ways that you can decrease your blood pressure? Low sodium diet, exercise, stress management, and increase fruit and vegetables in your diet. If you'd like to have a more detailed discussion about blood pressure, please view my other video. It's called Quick Tips for Lowering Your Blood Pressure. C stands for cholesterol. Now, cholesterol comes from the different fatty foods that we eat. Now, it's important to have some fat in our diet because we get more energy from cholesterol or fatty foods than we do from any other types of foods. However, it is important that we keep it under control and under certain values. The reason why it's important to keep it under control is because when we have increased fat in our diet, it blocks our blood vessels because it builds up in the vessel walls. Now, if you would like to have a more detailed discussion about cholesterol, please view my other video. It's called Quick Tips for Lowering Your Cholesterol. Now that we've talked about the ABCs of diabetes care, let's discuss a couple other tips to help you with your diabetes. Number 1, check your feet. You may have heard of different people having pressure sores or amputations. Amputations meaning different parts of their foot or leg cut off. Usually that's due to decreased blood flow to a certain area of the foot, causing them not to be able to feel. So what can you do to help you with your feet? 1, you can check your feet every single day. 2, you can also make sure that you keep your feet clean and dry, always wearing socks and shoes when you go outside. And then the last thing that you can do is making sure that you have your diabetic foot exam every single year. It may be up to you to remind your physician to do so. Number 2, have your eyes checked. You may have heard of people having vision changes due to their diabetes, and usually that's due to what we call osmotic damage. Osmotic damage just means that there's a lot of glucose in the blood vessels in the eyes, and that causes pressure changes, therefore causing decreased vision. So what you could do about that is go to your doctor every single year, have your eyes checked. That way they can prevent problems or discover those problems early. Number 3. This is one that everyone should probably know, but I'm going to go ahead and mention it. Make sure you have your regular doctor's visits and make sure you take your medications on schedule as prescribed by your doctor. That's it for this time. Thank you for tuning in to the Love Your Life series. I hope to see you next time.